Hi, I'm Dr. Tom Kravis, Physician Executive for 3M Consulting Services. Thank you for joining me. Today we're going to talk about ICD-10 documentation for obstetrics. There are some changes you will need to make in your documentation to support ICD-10, but there are instances of documentation that can remain the same. So let's get started. You'll find that ICD-10 is not as laborious as you might have thought. I know you are busy in your clinical practice, so I will briefly summarize the key takeaways. In your documentation of patient care, consider the use of adjectives, link the cause and effect of each condition, be specific about aspects of a disease and each anatomical site, and document the trimester or weeks of pregnancy. A little more on each of these. Differentiate in your notes whether or not a condition is mild, moderate, severe, acute, or chronic whenever appropriate. For example, write moderate pre-eclampsia instead of pre-eclampsia. Use due to or secondary to indicate cause and effect, and to record all conditions the patient may have, such as diabetes mellitus due to pregnancy or gestational diabetes. Think about the most current terminology to describe a condition or different aspects of the disease, such as gestational hypertension without proteinuria. Precisely designate anatomical site, such as cystitis instead of urinary tract infection. Document the obstetrical patient's trimester or weeks of pregnancy at the time of the encounter, such as gestational diabetes arising in second trimester, or proteinuria developing in the 34th week of pregnancy. Ask yourself, what else could I add in my notes about this patient's condition that would better communicate how sick the patient is, which in turn better communicates the resources needed for patient care. Incorporating these aspects into your documentation will result in an accurate picture of your patient's severity of illness and risk of mortality. This in turn will result in accurate public reporting on quality and outcomes. And it will help reduce the number of queries you receive to clarify your documentation. In the upcoming slides, we'll take a look at some diseases and procedures that have new documentation requirements under ICD-10. What's new? Most of the obstetric codes have a final character that indicates the trimester of pregnancy in which complications and other conditions occurred. This is more precise than ICD-9, where the defining point was simply antepartum. An additional code is available to precisely designate the weeks of gestation. Since you usually include information about the trimester and weeks of pregnancy in your patient care notes, additional documentation will typically not be needed. As in ICD-9, it continues to be important for you to specify when a condition or injury being treated is not affecting the pregnancy. Otherwise, a code for an obstetric complication is assigned. If the condition or injury is not affecting the pregnancy, then code Z33.1, pregnancy state incidental, is assigned in addition to a code for the condition or injury. For example, a 14-week pregnant patient presents to the emergency department with a first-degree burn of the back of the left hand. If the physician documents incidental pregnancy or otherwise states the burn does not affect the pregnancy, a code for the burn is assigned as the reason for the encounter, and code Z33.1 is assigned secondarily, as seen here on the left. Without clarifying documentation that the pregnancy is not affected by the injury, the encounter is encoded as seen on the right. Certain obstetrical codes distinguish between conditions of the mother that existed prior to pregnancy and those that are pregnancy-induced. This concept existed in ICD-9 and is not new to ICD-10. One example of this is pre-existing versus pregnancy-induced or gestational hypertension. Consequently, your documentation should clarify whether the hypertension is pre-existing or gestational. If the hypertension is pre-existing, any associated manifestations such as heart disease or kidney disease should be documented showing cause and effect such as heart or kidney disease due to hypertension. In ICD-10, we continue to have the ability to report gestational edema and proteinuria without hypertension. We can also report gestational hypertension without significant proteinuria. When edema and proteinuria are present, include the findings in your notes. It will help explain an increase in the number of office visits and other monitoring services. It will also clearly report the complexity of the patient you are treating. ICD-10 separates severe preeclampsia and HELP syndrome into two codes. In ICD-9, the same code was used to report both. Otherwise, codes for preeclampsia and eclampsia remain pretty much the same. For preeclampsia without pre-existing hypertension, you will still need to indicate the severity as mild, moderate, or severe. And as previously mentioned, for many obstetric conditions, we can report the trimester during which the condition occurred. For preeclampsia, the options are second or third trimester. Options for eclampsia also include second and third trimester, in addition to that occurring during labor or the puerperium. Diabetes mellitus is another example of obstetrical codes that distinguish between conditions of the mother that existed prior to pregnancy and those that are pregnancy-induced. If the diabetes mellitus pre-existed the pregnancy, make sure to indicate in your notes if the patient has type 1, type 2, or another type of diabetes mellitus. Make certain to link the diabetes to any manifestations of the disease, such as diabetic nephropathy or neuropathy, for example. What is new in ICD-10 is that the gestational diabetes and abnormal glucose tolerance test in pregnancy each have their own code. In ICD-9, they were combined into one. If the patient develops gestational diabetes, you will need to specify if the diabetes is controlled by diet or insulin. Make sure to clearly indicate in your notes when the patient has an abnormal glucose tolerance test, but no diagnosis of diabetes mellitus has been made, since there is now a code for it. There's nothing really new with regard to the coding of genitourinary tract infections in pregnancy. However, there is always room for improvement in documentation of the site of the infection, such as kidney, bladder, or cervix, and the organism causing the infection when known or suspected. For example, good documentation would be Group B strep infection of the cervix. ICD-10 has much greater detail to describe multiple gestation. As seen on screen, separate codes are provided to describe the number of chorions, amnions, and placentas. Since some types of multiple gestation require more monitoring than others, documentation of the specific type can help explain increased services and will give a clear picture of the complexity of the pregnancy. ICD-10 provides combination codes and in some cases more detail for reporting the cause of obstructed labor. Generally, 3 categories of codes describe obstructed labor due to malposition and malpresentation, maternal pelvic abnormality, and due to other causes such as shoulder dystocia or an unusually large fetus. Be as specific as possible in your notes when describing obstructed labor, whether it is due to incomplete rotation of the baby's head, a breech, face, brow, or shoulder presentation, or due to a maternal pelvic abnormality such as pelvic inlet contraction. Chances are ICD-10 has a code for it. As physicians are increasingly held accountable for patient outcomes, a huge concern is how to classify the patient who fails to follow a recommended regimen of care and gets sicker as a result. Under ICD-9, there is only one generic code for such a patient that says non-compliance, and no additional detail as to why the patient didn't follow your instructions. But in ICD-10, there are several codes to describe why a patient is non-compliant in taking drugs prescribed by you. This new clinical terminology is drug underdosing. Underdosing identifies a situation in which your patient has taken less of a medication than prescribed by you, either unintentionally or intentionally. Document in your notes why the patient isn't taking the correct amount of their medication and the associated condition. For example, patient at 34 weeks of gestation had follow-up blood work done after taking prescribed iron for 1 month to treat anemia of pregnancy. Her hemoglobin was found to be relatively unchanged after taking the iron. Upon questioning, the patient admitted to discontinuing the iron because it was causing constipation. Or patient did not take her antibiotics prescribed for treatment of group B strep due to financial difficulty. ICD-9 provided a single code for tobacco abuse and dependence without differentiation and without further specificity for the type of tobacco product. ICD-10 provides separate codes for these. If your intended diagnosis is dependence, dependence is what you should document rather than abuse. According to the Centers for Disease Control and Prevention, most smokers are dependent, and nicotine dependence is the most common form of dependence in the U.S. Additionally, further specificity is provided in ICD-10 for the type of tobacco product dependence, as cigarettes, chewing tobacco, or other, for example, cigars, so this should be documented as well. Your documentation should differentiate between current abuse or dependence versus a person who no longer uses tobacco. Starting in 2002, the number of former smokers has exceeded the number of current smokers. For tobacco dependence, ICD-10 provides the ability to report remission and withdrawal. Examples of nicotine withdrawal symptoms include irritability, anxiety, difficulty concentrating, and increased appetite. ICD-10 also provides the ability to show a cause and effect relationship between tobacco dependence and nicotine-induced disorders when documented. When a mother uses any type of tobacco product during pregnancy, childbirth, or the puerperium, a code from subcategory 099.33, smoking tobacco complicating pregnancy, childbirth, and the puerperium, is assigned along with a code or codes for tobacco dependence, use, or abuse. Finally, your notes for a patient's exposure to secondhand smoke can be converted to an ICD-10 code that says exactly that. This is a new category of codes in ICD-10. Previously, ICD-9 provided only a single code. You should document the type of abnormal findings, such as cytological, ultrasonic, or radiologic. We'll spend the next few minutes reviewing a few obstetrical ICD-10 procedure codes. The root operation delivery is unique to the obstetrics section of ICD-10. It is defined as assisting the passage of the products of conception from the genital canal. The root operation is only used for manually assisted vaginal deliveries. The root operation extraction, defined as pulling or stripping out or off all or a part of a body part, is used for all cesarean, forceps-assisted, and vacuum-assisted deliveries. Pay particular attention to the qualifiers column in the table for obstetrical extraction pictured on screen. The coder is dependent on your documentation to determine what type of forceps were used to deliver the infant, as well as what type of cesarean section was performed. For example, a low cervical cesarean section would be coded as 10D00Z1. A vaginal delivery with low forceps would be coded as 10D07Z3. You don't have to use the words delivery and extraction according to the ICD-10 coding definitions. The coder will apply the definitions based on your documentation of how the delivery was accomplished. When repairing a perineal laceration, it is important to document the type of perineal laceration, such as first-degree perineal laceration or third-degree tear of the anal sphincter. It is also extremely important to document in your delivery note what you are repairing or suturing. For example, if you document repair or second-degree tear, the coding professional does not have enough information to assign an accurate code. An example of improved documentation would be second-degree tear of vagina with suture of laceration of vagina. Here you see the table the coder will use to construct a code. Note that the body part selected is vagina. The code for this procedure is 0UQGXZZ. ICD-10 requires more detailed descriptions in your documentation of anatomical site and aspects of a disease, condition, procedure, and circumstances of patient encounters. The information generated from ICD-10 codes will result in a more accurate picture of your patients, their severity of illness, risk of mortality, and the services rendered. This in turn will result in accurate public reporting on quality and outcomes. Should you have questions about documentation for a particular diagnosis or procedure, your hospital's clinical documentation improvement specialist should be your first stop. The coding staff in your Health Information Management Department is a valuable resource as well. Thanks for joining me, and have a great day.